keep using that water tie, which is one of my favorites. Before we get to some of the questions from the breakout groups that we have, I have a question for our panelists. Because you're in this work and this is tough work. This is important work. What drives you in this work? Why are you doing what you're doing? You could do a whole variety of other things. Why is this so important? What is it that drives you in this work? Marguerite, why are you doing this?
I think there are many reasons, but I mentioned my background and my previous work, and the short sort of answer is I had a job where I was surrounded, or I felt like bombarded by inequality that was being not acknowledged and pushed under the rug, and it was just maddening. It was, and I decided to leave and go back to school, and I kind of felt like I wanted to devote my life to making some social change and promoting equity, and that's kind of what keeps me going. And I love making maps and drawing pictures, and so that's another thing.
Good. Kristin, how about you? What's in the pit of your belly that lights that fire?
Yeah, thank you for that question. I'm going to just sound totally corny here, but I really love the earth and I love our environment, and I'm really passionate about taking care of our planet and taking care of the people on the planet. And you can't really take care of the people without taking care of the planet, because this is environmental health. And I really feel very passionate about helping other communities that are trying to also take care of the planet. And so, yeah, I have a real affinity for the birds and the trees out my door, and I want to do what I can for them and then for the people that we all benefit from. So I know it's totally corny, but it's the truth.
We're all corn. All right, Ben, how about you? What drives you?
Thanks, Ed. I think I would go back to your opening remarks, Ed, really talking about climate change and inequities as two of the biggest, if not our biggest, existential crises at this time. And, I think that's what really drives me, not from a place of doom and gloom, but really to say we have an opportunity and I think an obligation to make change. And, just really thinking about how, I think as Kristin and Marguerite touched on, this is, we're fortunate to have this beautiful place to live. And I think, this is how I want to spend my work, spend my life is really making that a beautiful place to live for everyone. And I think, where my legal training comes in is being fortunate and privileged to have the opportunity to be an advocate and to really use that background to make change. And we've talked today about the importance of policy change, and just really being able to influence that. And so I think for all of those reasons, that's what just really keeps me going is really, being able to make change to benefit everyone.
Yeah, I mean, people always talk about, work-life balance and, separating work and I don't think public health folks do that. I think that it is on a continuum. We're so binary in our thinking, that's black, white, everything is on a continuum. And I think public health folks really work on social justice, social cohesion, and in building social capital. It's part of their personal work, but also part of the professional work. And you highlighted that quite nicely. I'm going to take some questions from the one that came into the chat earlier. Marguerite, somebody asked about, are you mapping the lead lines as one of those important issues? Because that's one of the issues that we're bringing up to the HHS secretary about the impact of lead on pregnant women and babies. Are you mapping that?
I have not, but I would love to, if folks have data, spatial data on the lead lines, would be really interested in facilitating mapping of that. And there may be folks who are doing that work, but I think it would be a really important project.
Right. And Ben, people were asking a little bit more information on the emissions from the gas appliances.
Definitely. I'm happy to speak to that a little bit more. And I want to thank Hudson for dropping a link in the chat, with more information on the dangers of gas appliances in homes. This is something that I think is really an emerging conversation, at least in Minnesota, just because of, as I mentioned, the prevalence of natural gas and propane in homes. But there's been some work done in other states that, namely, I think California is one of the leaders on, looking more toward decarbonizing end uses in homes. California is often an energy policy leader, of course, and so I'm hesitant to give too many examples from California for that reason. But I think there's a lot of conversation around how do we really take indoor air pollution out of our homes, benefit health, and I think importantly, not impose too many additional costs on customers. And so one of the things that is really, I think, emerging here in Minnesota is electrification of gas stoves, furnaces for home heating, to things like induction ranges in ovens or cold climate air source heat pumps. And I think there's still a lot of work to be done to really ensure that those technologies are truly affordable for folks. We want to make sure that it doesn't impose additional costs, contributing to energy burden, as I talked about. And also, we want to ensure that adding to electric load doesn't just increase air pollution from, electricity generation that comes from fossil fuel powered electricity generation plants. So we have to ensure that all of these things are being taken into account. But I think one clear opportunity is in new affordable housing. We, first of all, I think as Marguerite talked about so well, is we have to ensure that there's truly affordable housing stock for our under-resourced communities in Minnesota. And so as we're hopefully building more affordable housing to really house folks who need it, that's a clear opportunity to make sure we're building the right way from the first point. And so as we think about building new affordable housing, how are we really making sure that's sustainable, efficient, and ideally, low or zero carbon? We can heat those buildings with very little or no fossil fuels. We can equip those kitchens with induction ranges and cooktops to really make sure that we're not combusting fuels in homes. And so I think new construction affordable housing is a clear opportunity, but we also do have a lot of work to do to make sure that all Minnesotans have access to more electrified technologies, and that really starts with home heating and other end uses in the home.
Good, thanks. And Kristin, there was a question in the chat that I think is relevant to you and all of us and the issues, but it was particularly around climate change. How do we connect to people's main issues that are often nothing to do with climate change? I mean, that's a big issue that seems to be out of our control. How do we then connect climate to what really are in people's basic interests? They're, things that they do every day. How do we make this real for them?
Yeah, that's an excellent question. And I think when we talk about communicating about climate change, we really try to talk about what's happening locally in your community. So one way you can connect on climate change is saying, wow, I was out with my dog walking in November and the dog had ticks all over it. That's so unusual. That doesn't normally happen. So bringing, some of these things that are happening that are really driven by climate change to the center of their thinking. So things that they're experiencing right now in their community, that's really the best way to hook them in, because yeah, we're all worried about lots of different things, but if you can bring in your dog or, some other thing that someone can relate to, then you can start opening up a conversation.
Yeah. But how do we get them to believe in the butterfly effect? That every individual action. I mean, it seems so big that it's out of our control. What, if I recycle, what difference does it make? If I, get an electric car, what difference does it make? How do we get them that their little piece actually makes a difference?
Yeah, I think we have to just start there. That little piece does make a difference. I wish I had a better answer for you. Maybe someone else on the panel has a better answer on this.
Do you have any thoughts?
Yeah, I'll jump in briefly and then would love to hear from Marguerite as well. But I might touch on something that was raised in the chat around transportation and how we, think about how just the emissions from the transportation sector. And I think this is um, I think it connects well to your question, Ed, because all of us are contributing in some form or another, unless we're all walking or biking everywhere we go. All of us are contributing to that emissions inventory in the transportation sector, just from driving internal combustion engine vehicles or riding the bus, things like that. And so I think as we think about our individual choices around transportation, what opportunities are there for us to, either purchase an electric vehicle or push for, more of Metro Transit's buses to be all electric, or, think about how we're planning our cities so that folks can, walk or bike or, other non-motorized transportation to get around. And, how are we planning our cities so that folks can actually do that, run errands, go grocery shopping, go to appointments, in a way that isn't contributing to emissions from the transportation sector. And so I think that's a clear illustration of how our everyday individual choices contribute to that larger picture. And I think there's some very tangible examples within that of how we can think about change to really bring those emissions down, and I think really radically change how that entire sector contributes to our own health.
Marguerite, your thoughts?
Well, yeah, oof. I'm not a big personal choices person. I tend to locate things in the realm of the structural. So I do think that it's important to empower people to and give them the opportunity to make choices that are beneficial to the environment, and then maybe to show people that they have the agency to form collective power around challenging these fossil fuel interests, as been mentioned earlier. The people who are really, or the entities that are really the ones that are putting the most burden on our environment, I think is one way that we can kind of show people that there is power in their choices, but power in us coming together and deciding that it's a priority to actually center the planet and not the enrichment of large corporations.
All right, there's some questions in the chat that I'm going to summarize in a little different way, but it incorporates it. In our healthcare system, we have this binary focus of charity versus justice. Charity, meeting the immediate needs, but justice changing the system. And public health is more focused on sort of the justice changing the system, and the medical care is more the charity piece. Both are necessary. And it came actually in that what I read about the commentary about Hennepin Avenue, about the fact that economics are so important. We can't worry about climate until we deal with the economics. So how do you balance in your work the charity versus the justice, the immediate needs versus the long-term benefits, the immediate needs of individuals versus the community good that forms the basis of the individual, being able to thrive? How do you deal with that continuum? How do you make that balance? Ben, do you have some thoughts?
Oh, that's a big question, Ed. I think what I would maybe try to say from a policy standpoint is there are opportunities now to ensure that communities get the resources they need. We have utility programs, for example, that are serving customers, and we can work to make sure that more resources are going to those customers to help bring down bills, to help customers pay their bills, and just really give them an opportunity to really address their energy burden and give them more power over their choices. But I appreciate Marguerite's response just now. I apologize. I have a colleague named Margaret, so I keep slipping back into that. But I appreciate Marguerite's emphasis on structures, and I think we have to think about the opportunities that we have right now to ensure that resources are going to folks, but also what are the structures that those programs and just the policies that we're working on are operating within. And so I think we have to, it's a both and answer, I guess I would say, Ed, that, you know, we can think immediately about those program opportunities in the near term, but we also have to think longer term about structural policy change. And I think that's been a common thread of our conversation today. But just, you know, what are the venues that we're working in? How are we really bringing in impacted voices, and also ensuring that, you know, we're not working on longer term policies that are just going to lock in or worsen inequities that we've seen. And so I think that's really the dance that I try to navigate, and it's not easy, but I think really thinking of those near term program and policy changes, but then also identifying those opportunities for bigger structural change. That's incredibly necessary.
Marguerite, how do you do the balancing?
Yeah, that's a really good question. And sorry, I had to do a little change of venue quickly. But I think about this a lot in terms of some other aspects, and specifically in more of the kind of organizing work that I do, right? Where are we sort of emphasizing a charity model over more of like a mutual aid model, and getting folks involved in actually challenging and building community power, as Kristin talked about earlier. And so I think that's kind of where I locate this question, is how am I and how is my work empowering folks to actually, you know, or folks who have been affected by policies of inequality and discrimination for generations, to use their power collectively to make changes, to voice what they need, to bring solutions from those perspectives, rather than kind of coming in with this like top-down approach. Particularly as an academic, that's one of the most important aspects of that question for me.
Good. And Kristin, you're dealing with it every day. How do you do the balance of the immediate needs versus the long-term good?
Yeah, well, I think everyone's already said this, that you really do need both. And this is where you call on your friends. I mean, I think we're really lucky in public health here that we have so many, and I should not just say public health. We have partners in academia, we have partners at Fresh Energy, we have partners all over the system that, so well, some of us might be working on policies, others might be working on sort of daily basic needs. And we all, you know, just not one of us can do it all. It's just the same thing with climate change. It takes all of us, it takes the village to do this work. And, you know, I'm so grateful for all the work that everyone does to lift all of our communities up. And so I don't actually feel a ton of pressure on this one, because I feel like we have a strong community. We have a lot of people working on this. And our goal is to do the best we can in our capacities with our skills to lift people up and to give them the power they already have, but help break down barriers, or maybe give them resources that they didn't have.
Right. Well, we're at the end of our time here. We have lots more questions, but I'm going to give you each about 15 seconds just to, so one last final thought. Marguerite, your last thought that you have as a takeaway.
I'm just really grateful to have had the opportunity to join you all this morning, and I feel like I have learned so much, and I'm looking forward to continuing this conversation with folks. I, at Ed's suggestion, will put my email in the chat, so if people want to reach out and learn more about mapping prejudice, or just have ideas about how our work can center environmental and public health justice more, I'd be happy to talk about that.
Thank you. Ben.
Thanks, Ed. I just wanted to, again, thank everyone for the conversation this morning. I too learned a lot, and just really appreciated hearing from Ed, from Marguerite, from Kristin, and just the rich discussion throughout the morning. So just wanted to thank you all, and I will also drop some information in the chat, and look forward to continuing to connect.
All right, and Kristin.
Well, ditto to Margaret's comments and Ben's comments. Really can't say much more. I did just want to say, though, because we've been in this COVID land for a long time, and it may be easing up, but we really don't know for sure. I just want to really actually thank all of my MDH colleagues that have been working so hard on COVID for the past like 15 months. It's been really, really hard on people. And I know for some people, it's just been hard to get up and fight another day. So I just want to say thank you to all of my public health colleagues that have been working so hard on COVID. And thanks for joining us and taking a little break from that. And, thanks for this opportunity. And I learned a great deal as well, and just happy to be here and happy to be surrounded by such amazing people.
Yeah, well, and I join you in thanking all of our workers in public health at the federal, state, and local level dealing with COVID. And I hope we learn some good lessons from how they're doing the work, but also from the disease itself. So thank you to the panel, a wonderful panel, lots of good information. Could have gone on for a lot longer, but hey, we take what we can get. So I started, this session by talking about the existential threats that we have: nuclear holocaust and pandemics and climate change and inequities. And although these seem very disparate, they're, in their causes and their threats, they have one thing in common. They have a common solution. A changed narrative about what creates health is the solution to those. A narrative based on, as opposed to the common narrative about rugged independence and competition, it's about interdependence and social cohesion, about social responsibility and social justice, about cooperation and collective action. It's all about relationships. It's all about building community, building power in community. And as Wendell Berry, one of my favorite farmers, said, the community in the fullest sense is the smallest unit of health. To speak of the health of an isolated individual is a contradiction in terms. He talks about the fact that community should be the smallest unit of health. And he says a proper community is a commonwealth, a place, a resource, an economy. It answers the needs, practical as well as social and spiritual, of its members, among them the need to need one another. It is about relationships, feeling accountable for each other, feeling like we can count on others and have some responsibility. And so we need each of you. It's health in all policies. It's all people really working on what we do collectively to assure the conditions in which people can be healthy. So let me close with a little poem from Rabindranath Tagore, whose birthday was today. He was a poet laureate, a Nobel laureate in literature. He said, "Let me not pray to be sheltered from dangers, but to be fearless in facing them. Let me not beg for the stilling of my pain, but for the heart to conquer it." We have lots of stresses, lots of struggles in front of us, lots of pain that we have to endure. Let's embrace it. Let's move forward. Let's collectively be the change that we want to see. Let's work collectively to assure the conditions in which people can be healthy. So thank you very much. And I turn it back to our esteemed president.
Thank you very much. This has been the most incredible, thoughtful discussion today. And I want to thank everyone who's made this year's forums possible, and our panel and speakers for today: Marguerite Mills, Ben Passer, Kristin, Raab. Thank you, Dr. Ehlinger, for your incredible job as moderator. The Forum Planning Committee, Angie, Lindsay, Jean, and Leah, and Mary Grand, who works behind the scenes and makes everything flow perfectly. Thanks for everyone who's contributed time and support to bring this forum to you, as well as all of the attendees today. I think we've had some very helpful conversation that can move us forward. If you are not a member of MPHA, we invite you to join us in becoming a member. Check out our website at www.mpha.net. On May 13th from 8 to 9 a.m. and May 27th from 4 to 5 p.m., we'll be holding MPHA Connects events. These events provide spaces for follow-up and reflection from the 21-day Racial Equity Challenge that was kicked off last week's annual meeting. Our MPHA members and conference attendees are invited to join. It's not too late to start the 21-day Racial Equity Challenge. So to do so, visit 21daychallenge.prohabits.com and then start. And I invite you to join us for an MPHA annual business meeting and awards ceremony that will be held virtually again this year on June 15th from 3:30 to 4:30 p.m. Finally, calling all creative, inquiring minds. The Policy Forum Committee is looking for new ideas, topics, and speakers for the next Policy Forum series. Follow the Google survey link in the chat if you've got any suggestions for us. And once again, thanks for joining us today. We look forward to seeing everyone again for our fall 2021-2022 Policy Forum series. Thanks and have a great day, everyone. Bye.